I am demonstrating autologous conditioned plasma injection and how we prepare it using the Arthrex kit. First, we take the pictures of the person in all views, 45 degrees right and left, 90 degrees right and left, and the frontal view. The light for the pre and post picture should be the same. You can take these pictures using a tripod or a camera, and in our clinic we use a LifeWiz Quantificare 360-degree system, and along with that we sometimes use an Intense Studio Canfield system also. Now after we cleanse the face properly with spirit, we apply a thick layer of numbing cream which consists of prilocaine and lignocaine, and this cream is applied for a period of about 45 minutes so as to make the patient very comfortable. You have to see that in your tray you have the double syringe, you have 1 cc tuberculin syringes and 30 gauge needles, and besides that we also need the centrifuge system. This is a double syringe PRP tube or the autologous conditioned plasma tube. This is how it looks, and this is the centrifuge. It has 2 wells in it. One is for putting the ACP tube and the other is for putting the counterweight. Now the numbing cream is removed and we will be withdrawing blood before we process it. In a double syringe, we will be withdrawing 15 cc of blood. Out of the 15 cc, we can get approximately anything between 5 to 7 ml of the ACP fluid. This is how it is centrifuged. It is important to note that this is a soft spin, which is 1500 RPMs over 5 minutes. And this soft spin in this session has given me about 6 to 7 ml of the ACP fluid. Now very gently we remove the tube out, and without shaking it, we will withdraw the fluid into the inner syringe, and then the inner syringe is detached by rotating it. Now I have my fluid which is about 6 to 7 cc, and I will take tuberculin syringes and fill all of them, and then use a very thin needle like a 30 gauge needle to inject it into the skin. Now when we start injecting, it is very important that we assess the skin, the face and the neck, and we see which are the problem areas which we need to tackle. Sometimes a patient has certain dark patches like melasmic patches, or they may be having perioral hyperpigmentation, or they may be even having acne scars on their face or dark circles. So we also examine the neck, and I try to give extra attention to the horizontal neck lines, which we call the necklace lines, and as age advances these lines get deeper. Now I have taken 4 cc of the fluid for the face and 2 cc for the neck. We inject at a distance of 1 centimeter apart intradermally. The syringe is placed at a 30-degree angle and go 1 to 2 bevel deep. Now, suppose you have just started injecting and you want to be very sure that you don't miss any areas, then you can even draw a grid on the face. On the face and neck, we draw a 1 cc grid, and around the mouth, we draw a tighter grid, which is a 0.5 into 0.5 cc grid. As you see, I have marked certain areas on the face which are the areas of the dark patches. Now I am injecting 1 to 2 bevel deep, and on the neck you can give extra attention to either the dark areas or the areas with the extra crepey skin or wrinkles. Post the procedure is complete, we gently massage the skin so as to spread the ACP fluid under the skin. Now this is what the patient looks immediately post procedure. So you can see that she can go back to her work immediately. There is no excessive redness. The actual results will start showing in about 2 to 3 weeks time, and so we prefer to call the patient back for a post procedure photographic analysis.